Hello future nurses, confused about electrolyte imbalances? In this video, let's make sodium imbalance, that is hypernatremia, clear, including causes, clinical manifestations and management using easy mnemonics so that you never forget. So let's begin. Sodium. Normal sodium level in the body is 135 to 145 milliequivalent per liter. Sodium is essential for acid base balance, fluid balance, and mainly for nerve and muscle communication. So, to remember this, we know the symbol of sodium is Na, and from N, we have to remember the word neuro. That means whenever there will be a sodium imbalance, brain symptoms will dominate in that condition. And the way to remember is from the symbol of sodium itself. Na and N stands for neuro. So we have to remember that brain symptoms will dominate in condition of sodium imbalances. Now we know that normal level of sodium is 135 to 145 milliequivalent per liter. So two conditions can occur when sodium is out of balance, either hyponatremia or hypernatremia. In this video, let's discuss hypernatremia. Hypernatremia, serum sodium level exceeds 145 milliequivalent per liter. That means the sodium concentration is high than its normal value. So sodium level is more than 145 milliequivalent per liter. Let's discuss the causes for this condition for hypernatremia. And for causes, before discussing the mnemonic for causes, we know that it is a condition of hypernatremia. That means sodium is more than the normal concentration. And in any means in any type of imbalances, the main two causes are due to the ingestion or second is due to excretion. So if this is a condition of hypernatremia, the two main causes can be either there is increased ingestion of sodium, that is why sodium is more than normal in the body, or either there is decreased excretion of sodium as compared to water. If there is decreased excretion of sodium, either that is why sodium is more than its normal concentration. So you have to remember this in your mind whenever you are learning the causes or remembering them, that these are the two main causes, either due to increased ingestion or in decreased excretion. So for causes, the mnemonic is high salt. High salt. Hyper means high. Natremia is concerned with sodium, that means salt. So the mnemonic for causes is high salt. First we will H. H stands for hypertonic IV fluids. If excess hypertonic IV fluids like 3% NaCl are given to the patient or 21, then that can cause high sodium levels in the body. Also, if increased sodium bicarbonate is given, that can also increase the sodium level in the body. That can be a cause for hypernatremia. I stands for increased sodium intake, that is excess oral sodium ingestion. We already discussed due to any increased ingestion, any case that is leading to increased ingestion. So because of increased sodium intake, there can be a condition of hypernatremia. G stands for GI tube feeds without adequate water or NPU. If the patient is on tube feeding or is kept NPU, that means less water is given to the patient. So patient can easily get hypernatremia. Mainly when patient is on GI feeds or we can say on tube feeding, then as compared to the feed we are giving, we give less water to the patient because the patient cannot take water by itself. So the person who is taking care of the patient gives them water, and sometimes with feeds or in between meals we can say less water is given to that patient, and because of less water, they as compared to water the sodium concentration gets increased. So there is disbalance called hypernatremia in the body. H stands for hyperaldosteronism. If there is excess aldosterone, we know that aldosterone causes sodium retention. So if there is excess aldosterone, then more sodium is retained in the body, and that can be a cause of hypernatremia. Next is S. S stands for sweating, excessive diaphoresis. If sweating is causing more water loss, then as a result sodium is more in the body, so hypernatremia can occur. In case of sweating, we have to remember that sweat contains both water and sodium. We know that sweat contains both water and sodium, but the proportion of water and sodium loss decides whether whether means this cause is leading for hyponatremia or hypernatremia. If there will be excess water loss as compared to sodium, means more sodium is retained in the body, then that is a cause for hypernatremia. A stands for administration of sodium bicarbonate. We already discussed if excess sodium bicarbonate is given. Mainly sodium bicarbonate is given in metabolic acidosis. And if excess of sodium bicarbonate is given, then sodium load can occur. L. L stands for loss of fluids, fever, watery diarrhea, diabetes insipidus, infection. We know in these conditions, in fever, in watery diarrhea, more water is lost from the body. Diabetes insipidus, there is loss of more water and the urine is also less concentrated, we know, in condition of diabetes insipidus. And infection, these all conditions cause excess water loss as compared to sodium. So these are the causes of hypernatremia. T stands for thirst impairment or inability to access water, infants, elderly, or unconscious patients. These are the patients, like unconscious patients or the elder patients, they cannot drink water when they are in need, and also infants, they don't know when to drink water, so that the parents have to give water to the infants, and sometimes the parents are unable to meet the water requirements of the infant, and also elder and unconscious patients water needs are not met. So because of thirst impairment or the inability to access water, the sodium concentration is more as compared to fluids in the body. That is why hypernatremia can occur. So this can be a cause for hypernatremia. So these were the causes of hypernatremia, and the mnemonic for this was high salt. H was for hypertonic IV fluids. I's if there is increased sodium intake. G stands for GI tube feeds without adequate water. H hyperaldosteronism. S sweating if there is excessive diaphoresis. A administration of sodium bicarbonate. L loss of fluids, and T is for thirst impairment. So these are the causes of hypernatremia, which causes sodium overload in the body. Now we will discuss what are the clinical manifestations, or we can say what are the sign and symptoms that we will note in the patient with hypernatremia. And the mnemonic to remember hypernatremia is fried salt. We have to remember fried salt. F. F stands for flushed skin. Due to dehydration and increased sodium concentration in the body, the skin will look red, warm, dry skin. So that is flushed skin when it is red, warm, and dry. And in the persons with hypernatremia, because there is more sodium and less water or less fluid in the body, due to which flushed skin will be there. R stands for restlessness, anxious, confused, irritable. We know that sodium, in case of sodium imbalance, brain symptoms dominate. So if there will be high sodium in the body, the brain cells will shrink, which will lead to CNS changes. These are the CNS changes like restlessness. The person will be anxious, confused, and irritable. I stands for increased BP and fluid retention, or increased urinary specific gravity. Increased BP because there is more sodium, and more sodium in the body causes increased BP. And fluid retention. Fluid retention can occur in the body, which is a cause for increased BP. An increased BP will be a sign and symptom of hypernatremia. Increased urinary specific gravity. Uh, the urinary specific gravity will be increased in this case. Next is E. E stands for edema, mainly pitting edema. If there is excess sodium, we know that sodium will hold water in the tissues, which will cause edema. Pitting edema is that a pit is formed when we press the area or the site of edema, that is pitting edema. So pitting edema is common if there is hypernatremia, and this is mainly due to sodium excess. When there is excess sodium than water, not in the case of water loss, disbalance between sodium and water, there is adequate water in the body but sodium concentration is more as compared to water, that is the case when edema will occur as a symptom. D. D stands for decreased urinary output, that is oliguria, or diminished deep tendon reflexes. Now here we can relate increased urinary specific gravity with decreased urinary output, because kidneys will conserve water because there is more sodium in the body, so kidneys have to conserve water so that water and sodium concentration or water and sodium balance can be maintained in the body, because of which there is decreased urinary output, that is known as oliguria. And if there will be decreased urinary output, the urine will be concentrated, due to which there is increased urinary specific gravity. These will be the symptoms of hypernatremia. We have to correlate between the symptoms. And diminished deep tendon reflexes. Deep tendon reflexes will be diminished because of CNS depression. And also we will study the muscle weakness will occur with uh, along with diminished deep tendon reflexes. S stands for spontaneous muscle twitches or contractions, skeletal muscle weakness, seizure, stupor. We know that sodium is essential for muscle, nerve, and muscle communication. So, if there is disbalance in the sodium, nerve and muscle communication is not appropriate, so spontaneous muscle twitches or contractions and muscle weakness will occur. Also, seizure, which is a CNS condition, because of CNS depression, seizures will occur, and stupor, patient will be in a stupor condition mainly. The person may go into coma if that is very serious condition or if hypernatremia is not treated. Agitation, altered cerebral function. A stands for agitation, altered cerebral function. We have already discussed it. uh, We have already discussed that because of sodium, brain symptoms will dominate, and because CNS is very sensitive to sodium imbalance, so agitation and altered cerebral function occurs. L stands for low grade fever, lethargy. Low grade fever will occur in a case of dehydration, means when there is more water loss as compared to sodium. So sodium and water disbalance occur, there is more sodium in the body which causes hypernatremia, and the symptom is low grade fever. Lethargy, weakness, muscle weakness, lethargy, we already discussed. T stands for thirst increased because of dry mucous membrane. If there is excess sodium in the body and there is less water, our thirst body will stimulate the thirst center to bring more water or to increase water intake, so thirst will be increased in this condition. So these were the sign and symptoms that we will see in a patient with hypernatremia. F for flushed skin. R, person will be restlessness, anxious, confused, irritable. I, increased BP and fluid retention, increased urinary specific gravity. E, edema, mainly the pitting edema in this condition. This is important to remember. Pitting edema in hypernatremia. S is for S is for spontaneous muscle twitches or contractions, skeletal muscle weakness, seizures, and stupor. A, agitation or altered cerebral function. This is important. Altered cerebral function is the most common sign and symptom of hypernatremia. L stands for low grade fever and lethargy. Lethargy will be the early sign, and also thirst. T, thirst increase. Thirst increase. If we see a person, that person is taking water and is saying, after intake of water, also the thirst, patient's thirst is not okay. Means the patient again wants to drink more water. Again drinking. The person is drinking water again and again. So that can be a sign of hypernatremia. So, if you will see a person with thirst impairment or increased thirst, so you have to check the sodium level of that person. So, these were the sign and symptoms of hypernatremia. Now we will discuss the management. If these signs and symptoms are occurring in the patient, then how we have to manage this condition. And the mnemonic for hypernatremia management is sodium. Hypernatremia is a imbalance of sodium electrolyte. So the management mnemonic is sodium. Very easy to remember. S stands for sodium intake restricted. In this condition, there is excess of sodium, so we have to restrict the sodium intake. We have to avoid salty foods, canned foods, or processed foods, and also IV fluids. uh, Hypertonic fluids that was the cause of hypernatremia, we have to restrict those fluids. We have to decrease the sodium bicarbonate intake of the patient, so we have to restrict sodium intake to maintain the sodium balance. O stands for oral hydration. If patient is conscious and patient can't drink water, so we have to give water to correct dehydration that was due to hypernatremia and maintain water and sodium balance. D stands for diuretics that promote sodium loss. Loop diuretics, furosemide, which is most commonly given in this condition, so that sodium loss is promoted from the body and sodium balance is maintained in the body. I stands for IV hypotonic fluids, 0.45% NS or D5W. We have to give hypotonic fluids so that we can dilute. Hypotonic fluids will dilute sodium, and by diluting, the sodium level will drop to normal. U stands for urine output monitoring. Because the symptom was oliguria, so we have to monitor the urine output of the patient. Yes, also this is monitored to check, we can check kidney function of the patient by monitoring the urine output. And when we will monitor urine output, then we can check how much fluid is given to the patient, whether fluid retention is occurring, or we have to avoid fluid intake to the patient. So these all we can manage or we can implement only after the urine output monitoring. M stands for monitor neurostatus. This is important, monitoring neurostatus of the person with sodium disbalance, mainly hypernatremia, because sodium, in case of sodium imbalance, brain symptoms dominate, CNS symptoms dominate. So hypernatremia will affect the brain as confusion, seizures, stupor. These all symptoms will occur and many more that we discussed. So we have to monitor the neurostatus of this person. So to manage hypernatremia, we have to remember the mnemonic sodium. S for sodium intake is restricted. O oral hydration. D diuretics that promote sodium loss. IV hypotonic fluids. U urine output monitoring, and M monitor neuro status. So this was all about a hypernatremia. Hypernatremia, the condition in which serum sodium level was more than 145 milliequivalent per liter. So this was all about causes, clinical manifestations, and management of hypernatremia. There is a key tip to remember. Always correct sodium slowly, 0.5 milliequivalent per liter per hour, to prevent brain swelling and herniation. Whenever we correct a sodium imbalance, we have to correct it very slowly at the rate less than or equal to 0.5 milliequivalent per liter per hour, because cerebral swelling and herniation can occur in this condition. So this is very important to remember whenever we have to treat sodium imbalance. Stay tuned for easy explanation of other electrolytes in upcoming videos with Smart Mnemonics with SmartNurseGuide. Thank you.